Hello, everyone. Good afternoon. This is David Levy, one of the partners here at Diversified, and I'd like to welcome you to our next installment of our Wealth webinar series, Medicare 101. In a moment, I'll welcome Angie Wilson from Savoy Associates, which is one of our preferred partners in the Medicare space. Angie has more than 25 years of experience in the insurance industry, with 15 years specializing exclusively in the education and service of Medicare products. Celebrating over 5 years working at Savoy as a Medicare specialist, she has further honed her knowledge and experience in the consumer and senior markets and regularly educates both brokers and their clients on Medicare plan options to better assist them in evaluating and selecting their best fit plans. Per usual, we'll look to keep this to about 30 minutes, get you back to your day. If you have any questions during the presentation, please type them in the question box and we'll try to get to as many as possible, time permitting. And of course, if they are personal in nature, we can get with you after this. Also, Angie has let me know that we will be able to send everyone in attendance a frequently asked question sheet. Flyer, thank you. And I think that'll be a good resource as a takeaway here. So Angie, take it away.
All right. Thank you, David. First, I'd like to thank David and Diversified and Kelly for hosting today's webinar. It's a pretty simple webinar. It's probably going to take about 20 minutes to get through. And as David said, we'll try to answer as many questions as we can as we go along. If not, I'll have some information at the end with my contact number, email, and you can reach out to me directly with your personal concerns regarding this issue, or not issue, but Medicare. What is Medicare? Medicare is a federal system of health insurance for people ages 65 or older or with certain disabilities. It pays for part of an individual's health care expenses, and it is paid through your payroll taxes. Who is eligible? People age 65 or older who have paid taxes for 40 quarters, which is 10 years. People under the age of 65 with certain disabilities also qualify for Medicare. Individuals with end-stage renal disease, permanent kidney failure, requiring dialysis or transplant automatically become eligible for Medicare as well. The initial enrollment for Medicare is 3 months prior to your 65th birthday, the month of your 65th birthday, and 3 months after. What does Medicare cover? Medicare has parts A and B. Part A is your hospital insurance. Even when Medicare Part A covers your care, you may have to pay deductibles and co-insurances and things of that nature. There may also be services you get in a hospital or other setting that Medicare doesn't cover. So if you're in the hospital, you're going to get testing, doctors coming to see you, and things of that nature. You'll have to pay copays if you're on original Medicare, and also deductibles. Medicare Part B, it may cover a wide range of items and services, and there is a Part B deductible. Co-insurances, copays may apply here as well. So your Part B deductible this year is $203. It does generally go up every year, a couple of dollars. I believe last year it was $198. So this year it's $203 for your Part B deductible. Those are, again, your doctor's visits and lab services and any testing. So this slide specifically goes over what's covered under A and B. Inpatient hospitals care on A, inpatient mental health care, skilled nursing facility, home health, and some blood or for transfusions during inpatient care. Doctor's office visits on Part B, as I mentioned, outpatient hospital services, your minor surgeries, your same-day surgeries are covered under Part B, physician services, preventive care, lab services, blood, home health care, outpatient physical therapy, durable medical equipment, mental health, and ambulatory services are covered. So there are a couple of different ways you can pick up or get Medicare. Original Medicare is the first option, the parts A and B. Your second option is a Medicare supplement plan. On the Medicare supplement side, usually there's a premium with these plans. There are no networks involved in the supplement side. So generally, if your doctor does take Medicare, then they'll accept the supplement as well. Supplement does not include a Part D or a prescription drug plan, so you'd have to pick one separately. Those usually come with a premium. The average premium this year is about $38, but it depends on your list of medicines, what type of plan is best suited for you. Generally, those plans are anywhere from $15 a month to up to $100 a month. So again, it depends on your specific list of drugs, and we would look at that for you and decide what's the best plan, most cost-effective plan for you. Option 2 is Medicare Advantage or Part C. These are your HMOs and your PPOs, kind of what you're used to working. You have deductibles, co-pays. That Part B deductible doesn't apply on these plans, so you won't be responsible for that 203, but every time you go to the doctors, you'll pay a co-pay. If you're in a hospital, there'll be co-pays and deductibles there. The Medicare Advantage, again, I don't know if I said this, but there are networks with the Medicare Advantage, so you want to make sure that your doctors take any particular plan that you may be choosing on the Medicare Advantage side. Now, the prescription drug plans are included in the Medicare Advantage programs, so you don't have a separate premium. Generally, in most states and counties, there are $0 premium plans on this side. A lot of people like that option, but some people don't because they would rather not have to choose or be limited, I should say, to the type of doctors that they can go see.
Angie, do you find, I think that's a big question we get is it should I do the supplemental? Should I do Part C? And I know it's not a one size fits all, but what's more common and why?
Honestly, the supplements are more common because people just like to pay one premium and they don't want to have deductibles. There are several different supplement plans. So depending on the type of plan you choose, the more comprehensive the plan, obviously, the more expensive the plans are. Later on in the slide, I'm going to go over specific, like 2 or 3 different type of supplement plans that we offer. Not just us, it's all the companies usually offer the supplement plans. It doesn't really change. The benefits are the same for each supplement plan. The companies just charge different premiums. That's so different on the Medicare Advantage side because the Medicare Advantage side, some companies offer some additional dental and vision. So the Medicare Advantage, it's different for each company as far as the coverage, but on the supplement side, it is what it is. Plan N, Plan F, Plan G, depends on which one you choose. It's going to be the same regardless of what company you go to. Hope that answered your question.
Yes, thank you. Oh, you're muted, Angie.
Sorry about that.
Okay.
It's definitely not a one size fits all. So, the one-on-one conversation is probably the best thing to do. You can even reach out to me. Like I said, if you're interested or want to know more, then we can look at your specific situation.
Makes sense.
Does original Medicare cost anything? So Part A, typically there's no monthly premium if an individual or their spouse worked the 40 quarters or 10 years in their lifetime. In some cases, switching from employer-sponsored insurance for Medicare costs less and adds more coverage. So Part B, most people pay a monthly premium for Part B, which is based on your household income. Medicare supplement plans, Medicare Advantage plans, and Part D drug plans may cost extra. All right, my screen is frozen. It's not allowing me to move here. Oh, there you go. As I said, it depends on your household income, how much you're going to pay for the Part B. So here's the chart. I don't want you guys to have to write it down or memorize it. Just remember that you will get a copy of this deck at the end of the presentation. But yes, it does depend on your income, how much you'll pay monthly for your Part B. So the standard is $148.50, and then it increases depending on your household income. As I said earlier, the hospital and skilled nursing insurance, Part A, days 1 through 60, Medicare will cover all but 1,484. That gets confusing because a lot of people think that, oh, that's all I have to pay if I'm in the hospital for 3 weeks. That's not the case if you have original Medicare. You'll still be responsible for that 20%. So if doctors come to see you, you have tests, anything like that while you're in the hospital, you're still going to get bills for those particular services while you're in the hospital. I'm not going to go over each item here. You can look at it later and kind of go over, what the 61 through 90 and so forth and so on as far as the coverage is concerned. And if you have questions, again, feel free to reach out to me directly. Samples of Medicare costs, care under Part B. Doctor's office visits, outpatient services. Medicare pays 80%. You're responsible for the 20%. And also that $203 deductible per calendar years. And again, these costs are in addition to the monthly Medicare Part B premium, which you will need to pay. A Medicare supplement plan may cover some or all of these costs. And as I said, on the Medicare Advantage or the Part C, the $203 deductible does not apply on the Medicare Advantage. Medicare supplement versus Medicare Advantage. Kind of went over this already, but just to look at it again, original Medicare, never recommended. You always want to pick up something that's going to supplement, because otherwise you'll be responsible for 20% of everything. And if you don't pick up a prescription drug plan when you're first eligible, you may be penalized. Social Security does do a late enrollment penalty if you don't pick up a prescription drug plan when you're first eligible for Medicare. You're eligible if you are enrolled in Medicare Parts A and B at the time your coverage begins. You're a resident of the state you're applying the coverage for, age 65 or older, or under age 65 with certain disabilities in some states. Again, there's a specific situations for folks who are Medicare eligible due to end-stage renal disease. That's a total separate conversation. There's so much involved, and it is different criteria. You qualify for different things when you're in this situation or you have this end-stage renal. Medicare supplement plans, private health insurance plans for people on Medicare Parts A and B who want to help pay some of the healthcare costs that are not covered. Co-insurances, co-pays, as I mentioned before. The plans are named with letters of the alphabet, and the benefits do vary. And I think I said it before, depending on the more comprehensive the coverage is, the more expensive those plans will be. Here are those plans. So I'm gonna go over F and G. So F is the most comprehensive plan you can get right now. The only thing is people who are 65 before January 1, 2020, you can qualify for Plan F. If you're after that date, Plan S is no longer available. So that Plan F covers everything, including the Part B deductible, which is the $203 that I spoke about earlier. So again, you have to be 65 prior to January 1st, 2020 to qualify for this particular supplement plan. And as I said, the supplement plans don't change from the carriers you go to. It's going to be the same benefit, but as I said earlier, some companies do charge more. Plan G is the next most comprehensive plan. The only difference between F and G is the Part B deductible is not covered here. And honestly, the difference between the premium is more than the 203. So if you're looking and you're confused about the F and G, if you're 65 prior to 1/20/20, you'll kind of make your decision for you, because the premiums usually are $30 or $40 more on Plan F. So if you do the math, you're talking $360 or $480. So that $203 deductible is taken care of by the difference in premium. So it's definitely a personal decision there as well.
You lean towards G, is what you're saying.
Towards G, yeah. G is less expensive, but you're responsible for that $203 deductible. F will be $30 or $40 more a month. So, it's up to you. I mean, some people say, well, I don't want a deductible at all. I'll pay the extra.
And F is the only one that's no longer available to everyone.
Right. F is the only, F and C. But C is for people who are under 65 so there are other plans that you can get other than C, like for instance, N over here covers everything except the Part B deductible. Only difference with N and G is you're going to pay $20 copay every time you use it. So if you go to the doctors, if you have a testing, you have lab services, you go to the ER, and some people again would want to save the money monthly. They don't go to the doctor's often. So Plan N is a fit for those folks. But, like you said earlier, David, it's a personal decision for each person. And, if somebody comes to me and says, oh, I go to the doctors 3 times a month, Plan N's probably not going to work for them. They're going to,
as you can see, they make it really easy on you because they give you, no, I'm teasing. Look at all these different options.
I know there's so many options that we didn't even get to Medicare Advantage side yet. There's so many options there as well. But, on the supplement side, We generally only sell F, G, and N, honestly, because once we talk about, these other options here, like Medicare Part B, 50% here, and K and L, it's like, I honestly would never want anybody to be stuck with this. They might as well do a Medicare Advantage in this case, because almost the same. But again, it's a personal decision, so I'm not going to tell you what you should do or shouldn't do, but that's, again, a one-on-one conversation. Enrollment eligibility. So open enrollment, this is enrollment eligibility for supplement plans. So open enrollment is within 6 months of your Medicare Part B coverage. You have a guaranteed issue enrollment within 60 days of loss of other coverage. That means no underwriting question. So if you're really sick and you want to get a supplement, you'll qualify with no medical underwriting when you're first eligible. The only time you'll have medical underwriting is if you're moving from one supplement to another. You would apply if no other health insurance coverage exists in the prior 60 days. Also applies if Part B is beyond 6 months and no other health insurance is in place. Medicare Advantage Part C. All-inclusive private insurance plans. It replaces original Medicare, but it does not get rid of original Medicare. A lot of people get confused. Even the doctor's offices, when they're coming into the doctor's offices, I have a lot of clients call me, they said, you took away my Medicare. That's not the case. You're not losing parts A and B. You must continue to pay your Part B premium. The only difference is it pays the 100% of what Medicare allows. So on the supplement side, you're paying the companies a monthly premium to cover the 20% that you're responsible for. On the Medicare Advantage side, they're covering 100%. Medicare is in the background. Benefits and services equal to or better than original Medicare. Often includes prescription drug plans, as I mentioned earlier, and dental, vision, and other value-added benefits, depending on the plan you choose. Like I said, on the supplement side, it's pretty standard. The plans are what they are. Medicare Advantage side depends on which plan you choose, may offer more benefits. Generally, as I said, $0 monthly premiums often available. There are deductibles, co-payments, and co-insurance, kind of like what you're used to with your insurance now, the HMOs and the PPOs that you have while still working. What is Medicare Part D? Prescription drug plan that you can get in one of two ways. As I just mentioned, with the Medicare Advantage plan, it's combined. Or you can get it as a standalone prescription drug plan, often combined with the Medicare supplements. Or honestly, very few, but some people do choose original Medicare. They don't want to pay any extra. They'll just get billed for the 20%. You can pick up a standalone prescription drug plan in that case as well. Whew, this is a funny chart. I'm sure a lot of you have heard of the donut hole. The donut hole is right here, the catastrophic or the coverage gap that you reach when you are using a prescription drug plan. The standard deductible right now is $445, but it does vary depending on which plan you choose. Once you reach the initial coverage of $4130, you'll have copays and co-insurances on some medicines. And the coverage gap here, or the donut hole, as I mentioned, a lot of people don't reach this. I'd say, I want to say it's like 12 or 13% reach this. And this is for folks who are on a lot of brand name drugs. Once you reach this coverage gap, you'll have higher copays. Once you are past that coverage gap, then you'll go back to a lower copay. But again, a lot of people this doesn't affect a lot of people. Most people can take generics, and that's what we usually try to recommend. But there are a few people who can only take certain brand names. So this may affect you if that's your situation. So as I mentioned earlier, the Part B depends on your income. Also the same with Part D. So if your household income is on the higher levels, then you'll have an increased premium here on the right-hand side. And again, you're going to get a copy of this, so no worries. You don't have to memorize this chart.
And Angie, we have a question here.
Okay.
Oops, where'd it go? If you're retired and you're 65, where's the income pulled from to determine the premium? So it's from their tax return, correct?
It's the last two tax returns. It's the AGI. So if when you first retire, you have the higher income level, you can request to have it re-evaluated. There's forms on the Medicare.gov website where you can fill out and send in an appeal. And that will change, obviously, because as people go deeper into retirement, your income does lower. So you can get that, updated or adjusted.
Thank you.
Mhm. What should I be doing and when? Employer coverage and turning 65. Let's see. If you will not automatically be enrolled in Medicare, you should sign up for Part A when you're first eligible, even if you have existing coverage through an employer. This is because Medicare Part A is most of the time it doesn't cost you anything. If a beneficiary has an HSA account, this is important. They should not sign up for A or B. If they want to sign up for A or B, they must stop contributing for their to their HSA 6 months prior to obtaining A or B. Most people who are still working and are covered under their employer plan do not need additional coverage. I'm going to talk a little bit more about the HSA. I do have another fact sheet that is important, and I'm going to send it over as well, so you'll get a copy of that as well. I don't know if any of you guys are affected by the HSA, but there's a lot of rules here, and we can't go into it today because we'll go over the 30 minutes.
Yeah.
But I do have another fact sheet that is specifies.
Tricky is you can delay turning on Medicare to contribute to the HSA. You cannot delay Medicare if you turn on Social Security. So there's another
correct, and that's all in the fact sheet.
Yep.
I think it's a two-pager. I actually just created it a couple of weeks ago because I had a similar 101 session and there were tons of questions about the HSA.
Yep.
So I created a fact sheet. So I'll send that over too.
That'll be helpful. We get those questions a lot.
Absolutely. I'll send it over as well. So employer coverage and over 65. If the employer has fewer than 20 employees, you should sign up for Part A and B when you're first eligible. If the employer has 20 or more employees, you may be able to delay Parts A and B. So the reason why you have to pick up A and B is because Medicare is primary if their group size is less than 20. What should I be doing and when? Other coverage or no coverage and turning 65. In most cases, if you're receiving benefits, like you said, David, you will automatically get Parts A and B when you're turning 65. No coverage and over 65. If you are over age 65, you don't have Parts A and B and you miss your initial enrollment, you can sign up from January 1st to March 31st, and your coverage will begin July of the same year. You will incur late enrollment penalties in this scenario, if you miss your initial enrollment. So it's very important that you do talk to somebody when you're first eligible, just to make sure you're making the right decisions and there's no financial penalties going forward. The size of your group matters. We just talked about this, but we like to reiterate this because this happens a lot. So less than 20 employees, you must enroll in Medicare because by law, Medicare becomes your primary coverage. If you don't enroll into Medicare, claims may not be paid and you may face financial penalties due to late enrollment. 20 or more employees, you or your spouse are currently working and you have coverage through your employer, you may be able to delay Parts A and B. And we say may because you want to talk to somebody about that directly just to make sure that you're making the right decisions. Less than 100 employees. So if you or your spouse qualify for Medicare due to disability, Medicare would be considered as your primary. This is important. This is another thing that a lot of people miss. Disability is different than regular Medicare. So if your group size is 100 or less, Medicare is primary if you're on Medicare due to a disability.
Angie, when you say you should talk to someone if you have 20 or more employees, you're referring to someone like you.
Correct.
Okay.
Absolutely. Yep. We also have a contact center at Savoy. So generally what happens after these Medicare 101s, I get tons of emails, tons of calls, which is fine. That's what I'm here for. And I answer directly your one-on-one and I kind of tee it up to our contact center. The contact center will look up, if you're interested, if you're ready to go on to Medicare, the contact center will do all the quoting, check your doctors, medicines, and all of that. But I'm here for your initial questions.
The distinction I was trying to make was not your HR department, right? You would want to consult with outside help.
You're freezing up there. Am I freezing up too? Oh, okay. You were freezing up a little bit there, David.
I was saying the distinction I was trying to make is that so they should consult with someone like you, not their HR department.
Correct. And if they do go to the HR department, the HR department probably should go to you and then in turn send it to us. But we're here for all of that. We're definitely experienced and even the contact center. I think Our contact center has 6 agents, and I trained them, and they've all been in the business for 5+ years, so they're pretty knowledgeable. So all group sizes, if your prescription drug plan is not considered credible coverage, you may face a financial penalty after retirement. So we recommend that you do consult with your employer to make sure that that prescription drug plan that you're on while working is credible coverage. Usually they are, but it doesn't hurt to ask. COBRA versus Medicare rolls. So the first ruling says a person eligible on or enrolled in Medicare on the day of the qualifying event must be offered COBRA. Conversely, COBRA coverage will end when a person becomes eligible or enrolled in Medicare while being covered under COBRA. Honestly, there's really no reason for someone to have COBRA in Medicare, because you're going to, first of all, when you have COBRA, Medicare is primary. You're still going to have to pay that COBRA premium and your Part B premium. Generally speaking, maybe not so much now, because I know COBRA is a lot less expensive now, but I don't want people to get confused and think just because it's really inexpensive, they shouldn't go into Medicare, because it may cause you problems down the line if you don't pick up Medicare. Certain things, you lose enrollment, initial enrollment, and things of that nature. Generally, Medicare is primary once the member elects COBRA. The exception is to this is when the individual is eligible Medicare due to end-stage renal. Like I said, so many different rules with this. So if this is your situation, definitely reach out to me and we'll talk about this further. So the group plan is primary for the first 30 months of disability, whether the person is on a group health plan as an employee or a dependent or a COBRA continuation. Please note, an actively working employee who voluntarily terminates off the group plan to fully go on to Medicare is not a COBRA qualifying event for the spouse and or dependents, as the event of Medicare entitlement does not cause loss of coverage. I think I said this so many times already, but I'm going to say it again. There are penalties for getting it wrong. So your late enrollment penalty is 10% for every 12 months you didn't sign up for Part B when you were first eligible. The same for Part D, is 1% of the average. And I think I said earlier, the average is about $38 for the prescription drug plans per month you didn't sign up. And this is going to be a forever penalty. So if you miss this or you get this wrong, you're going to forever pay Social Security or Medicare more money. We don't want to do that. We never want to pay the government more money.
This is true.
What about my dependents that are on my company's coverage? So if you have dependents on your company's plan, you can remain on that plan if you're still working. If you obtain a Medicare plan, your dependents would have to obtain individual coverage. Frequently asked questions, coverage. Are my drugs covered? Depends on the plan. There's so many different plans, so many different formularies, and Medicare by Savoy will research all of that for you. Can I see my own doctors? If you choose a Medicare Advantage plan, you may have network restrictions. As you know, I talked about this before. Certain plans may also require you to choose a primary care physician to coordinate your care. And we'll definitely check that for you. Again, the conversation with our contact center will be very personal. It's a one-on-one conversation, and we'll check all your doctors, your medicines, and kind of advise you, what we think the best fit would be for you. Ultimately, again, it's your decision. When can I sign up or switch coverage? Initial enrollment period, again, turning 65. You enroll into original Medicare 3 months before, the month of, 3 months after. I feel like I'm reiterating things, but again, all this is important. So general enrollment period, again, is missed your initial enrollment. The enrollment into Medicare Parts A and B is January 1st, March 31st for a July 1st effective date of the year you apply on the general enrollment. Special enrollment, previous employer-based coverage, enroll into Medicare Parts A and B. You have 8 months from termination of employer's coverage to for that special enrollment. Annual enrollment. Annual enrollment is when you're already on Medicare and it's a Medicare Advantage program or a prescription drug plan that you want to change and reevaluate every year. Again, we'll do that for you. We're not just here for the first time you go into Medicare. We're going to be here for the life of your Medicare. So every year, if you're choosing of course, most people change their prescriptions every year. So we'll look at that every year for you to make sure you're still in the most comprehensive plan that suits your needs for that particular year. That's October 15th to December 7th. I'm sure you guys are are aware of that because there's so many commercials out during that time about the Medicare open or annual enrollment. Open enrollment period is a Medicare Advantage people who want to change their Medicare Advantage. They do have a one-time chance to change their Medicare Advantage after annual enrollment, January 1st through March 31st. So if you have a Medicare Advantage plan, you can change that all the way up until March 31st. How can a broker help? So as independent brokers,
Which you can tie this into one of the questions we received, which is how does Savoy make money, and is there a cost to work with you?
there is no cost. We get paid by the companies that we write for. So as independent brokers, Medicare by Savoy works with multiple health insurance carriers, make it easy to match with the plan. So we don't just have 2 or 3 carriers. I've lost count, honestly. We have almost all the carriers in all the states. And again, we get paid by the companies or the carriers. We don't get paid by the beneficiaries. This is a free service that's an added value for you being with Diversified as your broker. We do provide complimentary step-by-step guidance. We compare plans with different companies for you, help you understand the cost, avoid making mistakes and penalties. As we already mentioned, I think, 50 times I've mentioned already. We help you enroll and have coverage when you need it. We offer better privacy than online sales. So again, it's a one-on-one conversation over the phone. It is recorded. It has to be recorded because Medicare does require us to record all the conversations just to make sure that we don't mess up. All of our agents are certified through the government and the plans that we represent. So we have to certify and be educated every year. When should I engage with a broker? If turning 65, you should start about 6 months prior to your 65th birthday. If some of you guys are already 65 or turning 65, you probably are getting bombarded with a whole bunch of mail. That happens to all of our clients, complain about that. They don't even want to be on any mailing list, but it just happens. If you'll be losing coverage to your employer and are already 65 or older, you should contact the broker immediately for guidance. If considering Medicare, but you have dependents on your current plan, one of our brokers can help you with your dependents as well. We do individual coverage, so we can help you with both. Oops.
Perfect.
How is my employer involved? Coordinates the transition dates with you, make any necessary changes to your payroll deduction for health insurance, and can put you in touch with us at Medicare by Savoy. I already said that, questions and answers. And here is my contact information. And again, this will be forwarded to Kelly and David for them to send it out to everybody who's on the call today.
Angie, real quick, we got, I think, 1 or 2 questions here.
Okay.
When are you eligible for Medicare if you get a Social Security disability determination?
Determination.
Determination, excuse me.
24 months after you're deemed disabled.
Okay.
That's when you get A and B.
Okay. And there was a question that says, am I considered an actively working employee if I'm covered under a company retirement plan benefit?
If you're retired and you're covered under a company's plan, Medicare is primary. So you have to pick up A and B. You don't have to pick up anything else because obviously your company plan is secondary in retirement. But again, your retirement plan is secondary to Medicare, so you must have A and B. Otherwise, you'll get billed for the Medicare responsibility, which is 80%. That happens a lot. Honestly, a lot of people don't know that rule and they don't pick up Part B because they think, oh, I have employer retiree coverage. It's not 100%. You'll still get bills for 80% if you don't pick up Part B.
Okay, good. We're gonna. Any further questions, we'll make sure that they come to us or come to you. And
okay.
Thank you, Angie. And everyone else, thank you for joining.
Yes, thank you, everyone. I appreciate your time today. And David, Kelly, thanks to Diversified.
Yeah, for sure. And for everyone that's attending, as always, we are recording this and we'll have it posted on our website for easy access. And as always, feel free to share it with anyone you'd like and think that would find value in the information that was shared today. Keep an eye out later this summer for our next wealth webinar installment. And until then, stay healthy, stay wealthy, and stay happy.
Be well, everyone. Thanks, David.